Hi there, this is Dr. Lavinia Chong. I'm a board-certified plastic surgeon, and today I'd like to concentrate on 3 patients who exemplify techniques we see in the well-supported face. In the beginning, an accurate diagnosis has to be made before the appropriate plan is formulated and applied. In facial rejuvenation procedures or surgeries, the algorithm includes what is missing: fat, bone, skin. What has changed: skin quality, brown spots, loss of eyebrows, lashes, etc. And what has appeared: jowls, platysmal bands, big floppy earlobes. Are there any comorbidities or medical conditions which disqualify a patient from surgery? What did the patient look like 10 to 15 years ago? What are the patient's motives for proceeding now? Has the patient had prior cosmetic procedures? When, what, and were they happy with them? And are their expectations realistic? Did they budget enough time for convalescence? And what combination of surgical and non-surgical techniques will be required? And most importantly, how can the results be maintained? And so it happens. You look in the face, and somewhere in your late 40s or your early 50s, that reflection you see is not what you feel like. Here's a very attractive woman, around about age 49, who starts to notice some areas of dissatisfaction. In her case, it's concentrated in the lower third of the face, which is the area bordered by the base of the nose and includes the jaw and the neck. As you may see, she has some of these so-called gill lines, which are the vertical lines which emanate from her cheek down to her jaw. There are some lots of support. There may be some radial lip lines, and there may be some platysmal bands. As you can see on the profile, she has a good jawbone, but it's being disrupted by the appearance of the jowl and the marionette's line, which is the oblique line radiating from the corner of her mouth down to the jaw. These things make people feel a little bit insecure. Also, there's a little softness right under the chin where the jawline has lost its sharp clarity. In my opinion, the skin laxity over her jaws and neck and the fact that her jaw is not marked by loosened muscular bands did make her a better candidate for a non-surgical approach. I thought that the vertical gill lines that you see on the profile could respond to volume replacement. So for this lady, we proposed a combination of collagen stimulation using some injectables which stimulated her collagen and Ultherapy, which also lifted and tightened her neck and skin flap. In this picture, which is now 18 months since we started her treatment, we have used Sculptra, which is a collagen stimulator, to restore the volumetric loss in the lower third of the face, and we've also used Ultherapy, which is a non-surgical skin tightening. You can see that the submental area is much crisper, and she has no longer the vertical gill lines. In the same profile view, you can appreciate how that submental softening has been tightened and recruited upwards. The face shows a good balance without being overinflated or showing any awkward stuffing of the face with excessive fillers. Overall, this lady's been able to accomplish her goals in 18 months, and she looks better, in my opinion, than she did before the start of her treatments. The next case illustrates problems of aging in the upper third of the face, which is the area bordered by the hairline to the root of the nose. This lady has a significant congenital asymmetry between the position of her brow on the right, which is lower and flatter, and thus contributes to an excess of upper eyelid skin compared to that on her left side. She also has a relative relaxation of the lower lid, which gives her a very sad, tired look. In this picture, she is just 40 years old, so this is not an area to show significant accelerated aging. This patient's goal was to get as much symmetry between the right eyelid, eyebrow, to match the left side. So doing an eyelid lift alone would not have improved the eyebrow position. So in her case, we did an upper eyelid lift, a lower eyelid lift, and we did a transbleph browpexy, which is a procedure in which the position of the brow is accessed through the upper eyelid incision and fixated in place with a dissolvable clip. You may be wondering whether or not a dissolvable clip can hold the fixation, but here's the same patient 12 years later with a very good, durable fixation of her brow and what I believe is good symmetry between the right and left. The upper eyelid crease is crisp and well defined, and the pulling away that we've seen in the pre-op picture is being corrected by the lower eyelid. She said personally that she feels very good, and at age 53 looks as good, if not better, than she did when she was 40. This patient illustrates features in facial aging which are not really amenable to non-invasive, that is, injectable laser or non-surgical techniques. If you can look at her upper third, she looks tired. The upper eyelids are high and well approached. She has a deep eye, but she has a very fatigued look in the lower lids with eye socket rims exposed, and the overall shape of her face appears to be volumetrically lost, and she has also a significant male-looking appearance because of loss of facial fat. A month after her first facelift, she has a refreshed feminine appearance. The areas of fat loss appear to be blended, her fatigue and her eyes are reduced, and yet she appears very similar to what she looked like in pictures 10 years before. Time is inevitable and the results continue to show ongoing aging. 8 years later, after her first facelift, she shows again many of the stigmata of aging: loss of facial fat, descent of muscles, and overall a bottom-heavy look. So at age 68, she's had multiple rounds of non-injectables and feels that this is now no longer adequate. She's a healthy woman and has elected to have a secondary facelift. Here the patient is seen 8 years after her first facelift and after the second facelift. In the second facelift, the techniques were similar. However, the appearance relies heavily on the use of fat grafting to the temples, to the periocular, the mid-cheek, and also to the central lower third of the face to give a more pleasant, youthful, plump appearance. All three patients illustrate that given the correct conditions of diagnosing and understanding the patient's concerns, and then choosing appropriate procedures or surgeries, a well-supported, reversed aged look can be used and maintained.